Melillo Method is a unique treatment approach for developmental neurological conditions at any age. The unique principles that really underlie it really take into account the idea of looking at the development of the brain from the bottom up and then from the top down, and at the same time looking at integration of the two hemispheres as they develop. What we often see as the foundational issue in many developmental issues is really the fact that there are retained primitive reflexes that affect this bottom-up, top-down development, and at the same time there is an imbalance or a maturational imbalance in the development of the two hemispheres, preventing their integration. We also find that increasing core stability and strength is important. So we're using a unique combination of different sensory type of stimulation along with cognitive and nutritional based interventions to be able to help promote the proper development of the brain from the bottom up and integration of the hemispheres. It varies from patient to patient depending on level and age, but the overriding principles is that, and that's what makes the Melillo Method unique and effective. The Melillo Method addresses any sort of developmental neurological issue at any age. Most common diagnoses are things like ADHD, OCD, tics, Tourette's, autism spectrum disorders, bipolar, schizophrenia, even vestibular imbalances, so symptoms of things like vertigo, dizziness, balance issues, learning disabilities, processing issues. But our main focus here in our center is really dealing with the most severe and challenging conditions, especially non-speaking autism. We do also work with some genetic issues or brain injury. But our focus is really working with what we call functional developmental imbalances, where there is no clear-cut damage or injury, but there is severe symptoms and deficits. There is research supporting the Melillo Method and the approach. We have some research that goes back, outcomes research that goes back about 10 years, but of the last 4 years we've been doing a number of studies looking at the relationship between primitive reflexes and hemispheric integration in autism in particular. We have published in this year alone approximately 5 papers in top journals looking at some of that research. Over the next half of this year we have approximately 3 or 4 more papers at least coming out looking at the experimental data. So this is a randomized age-match controlled double-blind study that has been never done before, looking at primitive reflexes in autism, and all of that research will be coming out this year and beyond. How long it takes to see changes in the Melillo Method really varies from patient to patient, but typically if we're doing an intensive, usually within the first week to 2, we see significant changes. Obviously, we see changes over the course of time as we're working with patients, but usually those changes start with someone feeling their body, connecting to their body first, improve muscle tone, improve spatial perception. Sometimes we even see changes in speech, cognition early on, but generally we see a significant amount of changes in all areas over the course of several months to a year. The Melillo Method addresses developmental neurological issues at any age. We work with children and adults. We work with all ages. We have infants that we can work on only a few months of age. We also have people that may be in their 70s or 80s that we work with. As long as it's a developmental issue, it is something that we can focus on and we can help. The Melillo Method can be used in conjunction with other therapies. Many of the people that we see are on some form of medication or are doing occupational therapy, physical therapy, hyperbaric oxygen, diet and nutrition. We're a holistic treatment approach where we look at every aspect of the patient and we can work with all of those areas, but we're also happy to work with other therapists, physicians, school systems. What we find though is that the approach we have is very specific. We are trying to achieve balance in the nervous system and between the brain and the hemispheres. And some other therapies might address that in a different way or maybe interfere. But for the most part, we find that we can work alongside other therapies without any issues. The Melillo Method is designed to be a specific standalone type of treatment program. We develop treatment programs unique. Everybody is different. Every patient gets a unique program. But in all of the programs, they're designed to have a beginning, middle, and end. They do not go on indefinitely. There are specific goals that we set from the very beginning with the patients or with the parents, and we're usually pretty good at sticking to those goals. And of course, it really depends on the patient and how they respond. I think the Melillo Method is the most effective treatment program out there. Again, not only do we have research to support this, but we have many, many patients that we work with, and there are many different stories every day and every week of children and patients that we work with from around the world. Just recently we had a patient who started 1 year ago with us, and he had a number of different behavioral and emotional issues. He was diagnosed as being severely dyslexic, and he was struggling in school. Emotionally, he was very oppositional at home, and we did a number of tests on him functionally and showed that he was reading at approximately second grade level, even though he was in sixth grade. His reading comprehension was slightly higher. We tested him at 6 months, and he was reading at 4 years, 4 months. His reading comprehension was at 5th grade. And then when we retested him after 1 year, he was going into 8th grade, but he was reading at a 10th grade 6-month level, and he was comprehending at a 9th grade level. So he went from reading, word reading at a 2nd grade 5th month level to a 10th grade 6-month level in 1 year. So the idea that someone with dyslexia or a learning disability or with severe behavioral issues can't change significantly, we prove that wrong every day using objective functional measurements. I've been teaching a fellowship training program in the Melillo Method for over 2 decades. We have a number of people around the world that are certified in my method. When they are fully certified, we do make recommendations, and we have a list of those people that can be found on my website, drrobertmelillo.com. So you can go to that website and see if you have a certified Melillo Method practitioner in your area.